Hi, welcome to Wellness Woodbridge. I'm your host, Ann Mazza of Vito Mazza and Hair and Scalp Wellness. I'm so excited about our topic today. It's been long awaited, and we are thrilled to talk about the topic of mental health. It is a very big discussion. You know, we need to take care of our body in every aspect of the way, and that's physical, mental, and emotional. So we're so excited about the new opening of the Behavioral Health Center right here in Perth Amboy. That is a carrier behavioral health, also with Hackensack Meridian, and right here in our Perth Amboy location. So Dr. Arunesh Mishra is here to speak with me today, and he is a psychiatrist, and also he's going to help us shine light on lots of these topics and all of the beautiful services that are right here in Woodbridge and the surrounding area. Hi, doctor. How are you?
I'm doing good. Thank you very much, Anne, for inviting me today.
We're so happy to have you, and this is such a much needed health center. So we can't wait to talk to you about how you've been involved and how you got that to be something right here in this area.
Again, thank you, Anne, for inviting me, because such a important service which we provide in the local community. And I just want to say this, that we have been here for a very long period of time, for decades, but we were very small. We were only a psychiatric unit at Raritan Bay Medical Center. For decades, we ran about 26-bed unit, but recently, when we came with Hackensack Meridian Health, the expansion happened, which as you know, that we inaugurated in September of 2023. Now we are 81-bed inpatient psychiatric unit, so it's triple the size we used to have. Simultaneously, there are plans, and actually in 2024, we'll also be expanding our emergency psychiatric services, or EPS in short. We are 5-bed facility right now, and we are going to increase it to 10 beds, so doubling that capacity. So yeah, it's an exciting time here. We are expanding.
That's wonderful. So reeling back, doctor, how many hospitals, like in the general area, would you say have an actual behavioral health center that helps with psychiatric issues?
I would say that to some extent, every hospital helps behavioral health problems. Say probably in emergency setting, you can get emergency evaluations done. Almost every hospital, at least in HMH network, every hospital has that facility. But only very few hospitals have inpatient psychiatric units. Mm-hmm. And those are very few, say like Hackensack University has in northern region. In our area, I will focus only on our area, which is central region.
Yes.
Which consists of 4 hospitals, starting from JFK North, then Raritan Bay, then Woodbridge Medical Center, and Bayshore Medical Center. Out of these 4 locations of 4 hospitals, only Raritan Bay has inpatient psychiatric unit. And further to the west, we have Carrier Clinic, again, very long-standing, more than 100-year-old hospital, which has been there and known for its quality of service. So what has happened actually, that Carrier Clinic is a brand name, and this is what we are going to work with at other locations in HMH. So Raritan Bay Medical Center is the first facility to work with the Carrier brand name. So now we will be, not now, we have been called lately as Carrier Behavioral Health at Raritan Bay Medical Center, Hackensack Meridian Health. It's a mouthful, but this is what the designation is. And it indicates that we are part of the Carrier Clinic brand name.
Wow. So if someone goes to the hospital, I guess any hospital, there has to be an evaluation, I suppose, as to how we know if they're in need of emergent help, how we know if they need to be admitted to stay. So can you talk a little bit about that process for me?
Yeah, and it depends on the urgency of the situation. So suppose the need is urgent, that something is going on which is not manageable, waiting for the doctor's appointment or whatnot, then the best thing is to bring the patient to the emergency room. And in the emergency room, most of our hospitals have what we call EPS, or emergency psychiatric services. What happens is that when the patient comes, Patient is evaluated by our crisis team, which has a crisis counselor, a psychiatric nurse, and maybe in some locations psychiatric resident doctors will be there. So what they will do is they will evaluate the patient comprehensively to rule out any medical problems which may present as psychiatric or mental health issues.
Sure.
And once it is determined that it is a psychiatric problem, the team will determine what is the need right now, whether the patient can be treated as an outpatient, maybe on urgent basis, but still as an outpatient, or patient needs hospitalization. So if patient needs hospitalization, then we inform the patient, family, and the loved ones that this is what our recommendation is. I would say majority of time the patients agree with the recommendation and they come in voluntarily. But just so that you know that law provides for that if somebody is dangerous to either himself or somebody else or to the property, then even involuntary hospitalization can be recommended and the process can be started in the emergency room. So that is if the situation is urgent. But suppose situation is not urgent and it can wait, meaning management, then it's basically outpatient psychiatric treatment or behavioral health treatment. In that situation, what can be done is that various locations in HMH have outpatient facilities. For example, in our area, JFK Hospital has what we call a Center for Behavioral Health, or CBH. People can make appointments there depending on their problems. They cater with both mental health issue and substance use issues. At Woodbridge Medical Center, we have our own outpatient called Bay Behavioral Health. There we have pediatric or child psychiatry mental health services, adult psychiatry mental health services, so patients can make appointment there. And then we have therapists on both locations, doctors on both locations. So again, patient can be very comprehensively evaluated and then treatment plan can be discussed with the patient and started. Then the patient continues to follow on a regular intervals with the doctor. So that is outpatient management. One more thing, if we have time, I can tell you because it's very important, and this is not a common knowledge in the community, and these situations happen. So suppose somebody's loved one is in acute crisis and there is risk of life or limb, so to say, and families are not able to bring the patient to the emergency room because the patient may say, no, I don't want to go with you. Very common scenario. In that situation, there is something called state-run acute psychiatric services, APS. There is a number, I don't have number right now with me, but it's very common knowledge number. Families can simply call this number and a psychiatric professional along with the police officer will show up at the house and will do evaluation right at home and then determine whether the patient needs to be brought to the hospital. If that is the determination, they will facilitate transfer of the patient. So what I'm trying to say that for all eventualities, there is a service available and majority of services are provided by us at HMH.
I think the majority of people, I'm a social work background, are very unaware of what there is available.
Yep.
I think that when people start to feel mental health issues, the first thing they do is look for someone to help, maybe by recommendation or maybe in their health insurance, and then they may hit a road with getting availability for an appointment.
True.
And I feel like that is growing because many service providers are also saying, I'm not in your network and you need to pay outright.
Right.
For these services. So I think if anything today, I know that we're going to shine light on the fact that people can get help no matter what.
No matter what, yeah.
And, you know, if it's emergent and it needs to happen, that there are outlets and ways to get that information out. And funny that you should even bring up the home services, because I have a client who's actually one of those people that goes out and does that type
Yep,
of work.
absolutely.
And it's grueling and it's very difficult, I'm sure, but she's excellent at it, and it's inspiring to know that people are willing to help people to that level.
To that level, yeah.
So that says a lot
Yep,
for
absolutely.
where we are at in
Yep.
our world today. But it's great that, you know, we have the expansion ability, because I'm sure that you saw a need the fact that this was always here and it was at a small bed supply, that now we're going to have close to what?
81 beds.
81 beds isn't the greatest news, but there's a need.
There is a need, yep.
There is a need.
So let me just tell you something which, again, is common knowledge. So 1 in 5 adult Americans suffers from a mental health issue. That brings the number to 50 million Americans suffering. And do you know 55% of those don't get any care or help? No. 55% of those, 28 million people go without any help. Same way, substance use problems, substance use disorders, we call them now. About 37 million people every year are known to have substance use issues. 93% of them don't get any treatment for those. So this is the need. Another thing I will tell you, in 2022, the latest data which we have available, in United States, there were 49,500 completed suicides, meaning people died. 49,500 people died by suicide. That is one suicide every 11 minutes. Meaning, by the time we will complete the show, 3 more people would have completed suicide in the United States somewhere. Another way to look at it is very graphic, but again, I hope that it goes out everywhere. That the number comes about 136 people committing suicide every single day. Wow. It is almost like a Boeing 737-700 crashing every single day. Suppose that happened.
Awful.
How much hue and cry will be there? But people are dying every single day of suicide. Of course, we want to raise awareness and we are trying our best, but there is not as much attention we pay to the issues that mental health are not only problem behavior, they have outcomes which are very tragic for the person and the family.
Absolutely.
So I just wanted to put numbers that is what the need is. And I'm so happy that Hackensack Meridian Health saw it and took steps to provide as much. And that's why, of course, I agree with you that we should not have need for all these beds. But need is there and they need to be helped. And many, as I said, in 4 hospitals, we have only 1 location where, if you look at around New Jersey stands 23rd in the nation as far as the access to mental health care is concerned. Despite the fact that we are the most urban state, almost most urban state in the whole United States, access to care is limited. Not many hospitals have inpatient facility. So I'm really, really so glad that HMH made this decision and put resources there.
And tell me just a little bit, before we see the facility, which we are going to see very shortly, what is your role in this hospital and in the surrounding hospitals?
Well, as I said, I'm a psychiatrist by training. So psychiatrists are basically medical doctors who have chosen the specialty of psychiatry. Then there's super specialization within psychiatry. So I'm super specializing in geriatric psychiatry, which is old age psychiatry. Again, an area where, dementias and Alzheimer's disease is increasing like something, so, and very limited doctors who go in this field. So I'm also a geriatric psychiatrist by training. I did my fellowship. I've been working at Raritan Bay since 2005, and since 2008, I have been chair of the department at Raritan Bay. And when we merged with Meridian Health first and then Hackensack Meridian Health, I retained the position of chair of the Department of Psychiatry at both Raritan Bay and Woodbridge Medical Center. And I'm also in charge of or chair of Behavioral Health Department for the Central Region. And in the Central Region, we have 4 hospitals. So you can say that as chair of the Central Region, I oversee behavioral health operations in JFK Hospital, Raritan Bay Hospital, Woodbridge Hospital, and Bayshore Hospital. So that is what my role is.
Wonderful. This is going to be wonderful that we're going to get to tour this facility. It is beautiful. And when we come back after seeing it, we'll talk more and ask you a few more questions about how we can get more help for everybody. And hopefully we're saving lives today by having this conversation.
I hope so. And yes, very needed services which we are having.
Absolutely.
Yep.
So take a look at this beautiful facility right here in Perth Amboy.
1 out of 4 Americans suffer from a mental health illness or an addiction. So we knew the access to care was very important. We thought at Hackensack Meridian it was time that we took the lead to change the narrative for behavioral health care services in New Jersey. We're opening up an 81-bed center of excellence here in Perth Amboy at Raritan Bay.
We've only just begun to expand our healing influence. Our new space is soothing and sets the stage for healing. Our partnership with Carrier only strengthens our abilities to provide behavioral health services.
You couldn't be a patient and come here and feel anything other than welcome. You're going to get the treatment that you need and, more importantly, that you deserve.
This facility represents an investment in hope for the people of Perth Amboy.
Your efforts and your compassion will truly make a difference. I know it will be a wonderful, life-saving addition to the community.
We can see need has never been greater than what it is today. I'm really very excited that behavioral health is growing at such pace at Raritan Bay.
Hackensack Meridian is willing to make these significant investments for programs that are so essential for the communities that we support.
So beautiful and so local and so right here. So that was wonderful. Doctor, so nice to see that facility. And tell us like a little bit about, how it came to fruition. So you had the ribbon cutting, I know. We were unable to be there on location. And so far you are seeing quite a few patients over there, right?
Correct. So it has been a journey, this expansion to this and building brand new state-of-the-art 2 units, having 81 beds. It is beautiful. It is, as I said, state-of-the-art. The latest equipment is there. All safety precautions which could be taken have been taken, so that there is no dangerous behaviors which patients can exhibit there as best as you can. And I'll tell you that I have been in those meetings for 2 years. We planned for those, and we even chose colors, that what will be the best for a mental health situation or setting. There are big murals on the walls which were done by our employee in the past at Raritan Bay. We digitized them and put in the new floors so that we keep that continuity. So yes, very nice. I think I've been in field of psychiatry for 35 years, but I've never seen better inpatient psychiatric unit. We are already using the floors. Patients are coming, real life, and patients are being treated there. So yes, addition of beds have helped another situation, which is crowding of the emergency room because of the lack of inpatient beds. What happens is the patients come to the emergency room, they need hospitalization, but all hospitals have their beds full to the capacity, so they had to wait in the emergency room. So increasing the number of beds is going to help that situation as well.
Excellent. And how about staffing?
Staffing has been a challenge, I have to say this thing, because finding so many nurses, so many mental health technicians, we have been lucky so far in finding the doctors and providers. So we are doing well in that area. But nursing and mental health technicians, social workers, very difficult to fill the positions, but we are working on it.
So when you have a nurse in that area, in that setting, is it a separate type of nurse that you need, or could it be a regular RN in the behavioral health?
No, they are behavioral health trained nurses. They have to go through certain trainings and attain certain competencies. It's a totally different track in which they have to train, and then they become psychiatric and behavioral health nurses.
So maybe even putting that word out today, to any medical professionals that are at home that want to, help locally and be right here in the Perth Amboy location.
Absolutely, we need them.
Excellent.
Yep.
So when a patient needs to go, I would like to get to the viewers at home as to when would be the time that they need to go seek help for something psychiatric where they just feel maybe no hope or they feel out of control.
Well, that depends on what type of symptoms they are feeling, so some people may feel, say, I'll give common one or two examples. If person is feeling depressed, and if, meaning one has to differentiate what is, sadness is a normal emotion which can happen to anybody anytime, in appropriate circumstances and in appropriate intensity. But when sadness persists, and it is associated with other symptoms like you are not able to eat, you are not sleeping, you have no energy to do things, you do have poor motivation, and more than that, if you start questioning your own life, then definitely is a time that you seek professional help. Now, depending on, as we discussed before, if it is emergent situation that you feel that you may lose control of your own action, then going to emergency room is the best option. But if situation is not as emergent, then definitely you can make appointments with the outpatient providers. So that is, say, in the area of emotion of depression. On the other hand, in psychiatric disorders, psychotic symptoms like hallucinations, and hallucinations are experiences without any stimulus there, meaning you start hearing voices when there's nobody around, or see things which other people don't see. Those kind of symptoms. Sometimes people start believing in certain things which are not facts, have delusional thinking. If the family members notice that, that is definitely a reason for seeking psychiatric help. Again, depending on how emergent is the situation, you will go for outpatient versus inpatient.
So can they call the behavioral health facility to get pointed in the right direction, or is it more that they should go, in that other direction to try to find someone first?
Right. So again, if it is emergent situation, it is best you can give a call to the emergency room, but you don't even have to do it. In emergent situation, you just go to the ED, and they will take care of it from there on. In situations where we can wait, best thing, my best suggestion would be that your primary physician can be a resource for you, that you can talk about that these are the emotions I'm going through, what do you suggest? I will have to say this thing, that sometimes primary physician can handle mental health issues also, so maybe those issues will be handled right there. But suppose that is not the case, they will be able to give you a referral to the doctors and the providers in the network they know, who work in the local community areas. Suppose another way of going for finding the mental health provider is through your insurance company. That is another way of, and lastly, it is word of mouth, that some family, friend may have seen a mental health professional and they liked this person's, clinical skills, so you can go that way. These are common ways to find.
So, doctor, I know that you've done this for many years. So I think what I would like for you to shine some light on is how people have been able to overcome this, that there is hope, that getting help, getting therapy, maybe seeking medication when necessary, that these are all ways for people to heal from mental illness. I think sometimes people think, well, I'm mentally ill. Oh my gosh, now I'm mentally ill forever. People go through ebbs and change in life.
Absolutely.
And, we all hit the wall at points in life. So I'd like you to just shine a little light on how you've been able to help people and change for the better.
So let me say this, that majority of the mental health issues are acute in nature, short in duration, and with appropriate help, they get completely resolved. No doubt about it. Those are situational, related to the stress in life. If you have appropriate help, they will not become bigger issues and they can be treated there. I'll say this thing which everybody should listen to this very carefully, that even the chronic mental health problems like bipolar disorder, schizophrenia, major depression, which keeps on recurring from time to time, all these are very manageable medical issues. And I'm saying medical issues because they are medical issues. They are not different than any other. I will go on a limb to say this thing, that they are as manageable as hypertension, meaning blood pressure problem, diabetes are. we can control. We cannot cure hypertension, we cannot cure diabetes, we can manage them. Same way, with appropriate treatment and support and help, schizophrenia, bipolar disorder, major depression, chronic anxiety disorder, obsessive compulsive disorder, they can be managed to the extent that your quality of life remains good and you're able to function in the society well. So yes, treatment is there. The only thing is that you need to seek that treatment and stay with that treatment.
Well, I think our conversation today is going to shine light on that and the hope and the resources that are available for people. That there's always someone who maybe in your own circle you don't feel that support. There are people who want to help.
Absolutely.
So it's just helping people get to that area of finding that help, and having this right so close by is just a great option.
True. Absolutely. With this new expansion in our area, Middlesex County and surrounding area, we have plenty of behavioral health services available, inpatient, outpatient, emergency room, and even when you are hospitalized in a hospital on medical surgical floor, and if there are psychiatric issues or behavioral health issues, can be addressed very well. One thing which we did not touch much on is substance use disorder. That is another thing, because person who is using the substance, they may have in the back of their mind that I'm excessively using it or abusing it, but generally that insight is not there. Families know more. And sometimes we become hopeless when a person has long-term substance use problem, that, oh, it's not treatable. But with today's treatment modalities, all these disorders are very manageable, as I said, as any other chronic medical disorder. The thing is that we have to come to the treatment, person has to, and families and agencies, community agencies can provide that help. And once the patient is in there and stays in the treatment, outcomes are really good.
That's great. Well, I'm so happy that we've had this time together and that we have had this conversation and opened, hopefully, many of our viewers' eyes to all of the options that are available. And many people do feel that they need use of these services. So I'm praying that today will be a great, great conversation and helping a lot of people and maybe saving lives like we spoke about earlier, because it really is an issue. You know, there's lots of health issues in this world, but emotional and mental health is certainly something that needs to be brought more to the forefront.
Absolutely.
So I can't thank you enough for helping us do that today.
Thank you.
And we're so happy to have something right here in this community that can help people, you know, when they're feeling that lack of hope.
Absolutely. Thank you again.
Thank you, Dr. Mishra, and thank you for being a wonderful professional and helping people as well.
Oh, thanks again.
All right.
Very good.
And thank you for joining us today on Wellness Woodbridge. We hope that we educated you and inspired you, and that if you know anyone who's in need of these types of services, or you are yourself, that you can realize that there's always someone there for you, someone who cares, and someone who will reach out their hand to help. And they may not be someone in your immediate family, but these services are available, and we care. And we do right here at Wellness Woodbridge. So always remember that you are a whole person, physical, spiritual, emotional, and mental. And we want to take care of you in this wonderful Woodbridge community. So thank you again, and we'll see you next time on Wellness Woodbridge.